Hello, everyone. My name is Mark with United States University, um, FNP 596. Today, I will be presenting a case of a patient by the name of CJ. She is a 57 years old African American female who present to the clinic unaccompanied. She is well dressed, she appears well nourished, and she is a reliable historian. As chief complaint, I quote, I'm dealing with a persistent cough for the last 3 weeks, and sometimes I experience shortness of breath and fever. End of quote. As history of present illness, CG present to the clinic today with a persistent cough that has ongoing for the past 3 weeks. She also reports fever, especially at night, and shortness of breath with physical activities. She denies chest pain, she denies alcohol consumption, and has decreased her smoking habit considerably. She is married and is sexually active. She is not exposed to any irritant that can trigger her cough. As past medical history, she had a history of fibroid. She had a hysterectomy 5 years ago, and she is allergic to oxycodone. She has a present history of hypertension. She is taking losartan hydrochlorothiazide 50 12.5 milligram per tablet once daily. Once daily. She has no recent hospitalization. She is to date with her vaccine, including the COVID vaccine. As medication, she is taking only losartan hydrochloride thiazide 50 12.5 milligram per tablet once daily. As social history, she is very active and leads girls' activity in her local church. She attends a book club twice a week. She is living in a secure environment. She tries to keep a healthy diet and exercise daily. She has a family history of her mom having hypertension and her dad has diabetes type 2 and he's a smoker, but both are still alive. As review of system, while the cough worsens, she occasionally experiences fever, but she denies nausea and vomiting. She denies palpitation, chest pain, but often experiences shortness of breath. She is alert and oriented, and her vital sign has objective data. Her vital sign, blood pressure 120 over 82, heart rate 72, respiration 20, temperature 97.9, oxygen level 99%. She's alert and oriented, no acute distress. She's a good historian. The HENC assessment, no abnormal finding. Her cardiovascular assessment, no abnormal finding, S1 and S2 present. And respiratory function, when listening to the patient's lung, I can hear a combination of crackles, bronchi, and wheezing sounds. It could be a bacterial pneumonia. Cardiovascular assessment, no abnormality finding. So as differential, I have pneumonia, acute bronchitis, and asthma. To design the best care plan possible, it is vital to consider the most accurate diagnosis by conducting further investigation. A chest X-ray will help determine if pneumonia is suspected. Pulmonary function test will be important to check for possible asthma. Allergy testing I help determine if there is any potential allergy linked to this cough. A bronchoscopy or CT scan may also consider for a better understanding of the coughing issue. A complete blood count will help identify any underlying infection. Due to the symptom and the lab test result, the most relevant diagnosis for Mrs. CG is bacterial pneumonia. As treatment plan and education, amoxicillin 875 milligram per tablet. She will take one tablet by mouth every 12 hours for 5 days. And she will quit smoking. And it is vital to comply with the healthcare provider recommendation, and will a follow-up appointment is scheduled in 1 week to keep track of the progress of the care plan and determine if modification is necessary along with further testing and examination. Thank you.